Great to be here. My name is Jonas Wells. I'm going to talk a short moment, 10-15 minutes, about solutions focus and change in the welfare systems. I work in Sweden for something called a coordination agency. I'm going to talk a little bit more about that so you get an idea of what I do on a daily basis. I juggle two roles. I'll juggle both the national role, this NNS, which is a national network of coordination agencies, and I also work locally for Södra Dalarna's coordination agency, which is in South Dalarna, which is in the center of Sweden, roughly. I work both as a developer, trying to help my fellow colleagues and people within overall Sweden, working with coordination to improve their work and communicate that work also with national bodies. I also work locally with managers, leaders.
Can you speak more slowly?
Speak more slowly, I'll try. So yes, I work with leaders, politicians, and staff on a local level to coordinate services around people who need coordinated services. Anyway, my background is in anthropology, so it reflects a little bit the way I look at the world. And I was drawn to solutions focus in 2002. What I draw much from anthropology is the idea that we are very good at imagining things all around the world, different cultures, different groups, different people, even ourselves. On a daily basis, we imagine better worlds or better lives, better days, and we co-construct our lives and our social environments. And this rhymes very well with the basic tenets of solutions focus. And so when I heard about solutions focus, I was naturally drawn to it. I've worked both with clients early age. When I started with solutions focus 2002, I worked a lot with clients. But nowadays it's basically with organizations and their staff and politicians and stuff. Anyway, big picture of what I'm going to do in these 10 minutes ahead. Coordination agencies in Sweden, short introduction of what that is. I'm going to try and give you a snapshot of a good story in Norberg in the center of Sweden, which I think is quite cool. And then I'm going to also talk about the national project which I'm working on at the moment, which I think is also quite interesting. Coordination agencies. Where do we start? We can start with, in 2004 in Sweden, the government created the opportunity for social insurance office, job centres, healthcare systems and municipalities to create a new form of statutory body whose aim is to help, support and finance activities for these four different sectors in order to aid and support services for people who need joined up support. And the aim of this is to help them get closer to work. So the group is 16 to 64 years old. The groups that these organizations are struggling with are often people with psychiatric disorders, low self-esteem, dropouts from school. But there's a wide range of problems, and often these are the most difficult problems for public sector organizations to work with. So they need help, and they need each other. So this is why they created coordination agencies. There are about 80 of them in Sweden, and most of the municipalities are a part of this in Sweden. So there's only, I don't need to go into that. I think coordination is a really cool idea. It solves three basic problems. When trying to create new services for people who are in need of joined up services, it creates the opportunity for pool budgets. It creates a joint decision-making capacity. These agencies are independent and can make their own decisions about how to use the coordinated money. And they have people like me working professionally, helping and supporting coordination and the development of coordinated services in a facilitating role. Now, I'm going to talk about Norberg. Norberg, see the arrow up there is roughly in that part of Sweden. The other map here is you've got Stockholm, and somewhere out in the woods we have Nuremberg. It's an old town. You can see some of the pictures there. There are about 6,500 people living in Nuremberg. It's a little bit off the beaten track. Used to be a centre in the Middle Ages, had a big mining industry in the 18th, early 19th century. But since then, time has kind of left Nuremberg to its own devices, and has a history of a high degree of unemployment and sickness, and lots of people who find trouble finding a future in that area. The girl there is the mayor of Nuremberg. We're going to we'll return to her soon. Her name is Åsa Eriksson, and she is very much inspired by solutions focus. So I'm going to talk a little bit about Nuremberg. This is a picture of total benefits in the areas of unemployment and sick leave and disability benefits in Nuremberg and the area. We have the two bottom ones here are for sickness. These are short-term sick leave, disability benefits, which are more long-term. The two next are unemployment benefits. One is an activity benefit, and the other one is more passive unemployment benefit, and the green one is social welfare. And together, these, when you put these on top of each other, we get an idea of how much is totally being paid out in different forms of benefits. The story that I'm going to tell is how come Nuremberg went from a peak in 2005 down to where we are today, and this was a dramatic change in how the development of the progress of how these disability benefits went down. I'm going to say most of the places in Sweden went down during this period, but Nuremberg stuck out. The rate of change was much faster than anywhere else. Minus 38% in 8 years. And nobody could put this in a plan. It's a massive, massive difference. So what made a difference? I've got three voices I'm going to share with you. This is Eva Dickfors. Some of you might know her. She works as a counsellor for the local clinic. I can tell you in the clinic they have, if you go into the clinic today with any sort of ailment, a diabetes ailment, a depression, or in need of help, you're offered a 3-week course in solutions focus, where you go through your life situation, what's working already, meet other people in the similar situations, and lo and behold, many of those people don't continue their sick leave career, as it were. Many people find the help that they need and can move on with their lives. She has had more than, I don't know exactly to this number today, but for a year ago she had over 30 groups. And this is something that's implemented and being run on a weekly basis in the clinic of Nuremberg. She says the difference for her is that they've developed good ideas, practice and a way of working, where a great number of people get joined up support from the authorities. This is one of the type of activities that the coordination agency has supported. Other activities are teams where different professionals from different organisations work together with clients who need more help. Another thing, this is the highest executive manager from the state-owned organisations, the Social Insurance Office, Henry Komalainen. He says collaboration is working very well between the different authorities, especially with the municipality. And they participate in each other's leadership programs, in their education systems, and they have a very stable clinic situation at the clinic, like I was saying earlier. And this has developed over time. So this is something that's evolving and has a long history of cooperation. Åsa Eriksson, our mayor that we met earlier, has two reasons for this major difference in Nuremberg, saying that authorities have developed a very good collaboration. And there's a culture where people talk to each other and find ways of moving forward in a productive manner. I met up with Åsa just a few months ago and wanted to, what's happening today? How is solutions focus a part of your culture and how part of the municipality's work. And she said, two things. Solutions focus is when we take the biggest decision we take every year is our budget. And in the text, in the budget, it says we work solutions focused. The leaders are supposed to work with solutions focused and develop solutions focused. It's a very active ingredient of the way they work. And another thing is, and I said, how does that manifest itself? How can I see that? And she says, well, we managed to keep the Wailing Wall outside of our meetings. So we managed to keep us focused on resources. We keep ourselves focused on what's constructive and useful. And this is also in Nürnberg. I don't know if you heard that last year there was a huge fire in Sweden. I don't know how many of you know about that, but there was a huge fire, and it came to the borders of Nürnberg. So in periods of high stress, they were literally evacuating the city. They could draw on each other's resources and draw on the cooperation, the collaboration that they need to have in order to deal with higher acute situations. One of the reasons why all this happened in Nürnberg was this continuity that Henry was talking about. Courses, trainings, meetings, where solutions focus is both the form and the content. It's made a huge difference. Another example, indicators. This is more a national thing. And I'd like to say something about how this has developed. It looks very linear and lovely, but it's not. We work very, very closely with small steps along the way, and now in hindsight, we can look back and say, look, this is a long development, and we kind of knew what we were doing all along. We didn't. We asked ourselves the questions in 2012. Two colleagues of mine from two other agencies got together and said, look, we work in similar ways. We have a similar strategy. Could we have a similar evaluation policy? Could we learn from each other? If we work in a similar way and we think we're doing similar things, could we ask the same questions? Could we get our best ideas from each other? So we spent the early parts of 2013 inventorying kind of like the resources, what we already were doing, which was working. We looked at our strategies and why we thought they would make a difference. What difference would it make if we worked more long-term rather than short-term? Building teams and developing leadership. We thought, how would we notice that would make a difference? We ended up with the idea of developing indicators. And we spent a whole year asking colleagues all around Sweden. We went to workshops nationally, we went to regional conferences, we went locally, we went to user organizations and asked them, how will we notice if collaboration was working better for your client groups? And we ended up with 137 indicators. Specific indicators. We looked for resources we're not experts in evaluation, so we looked for resources who could help us. So we went to the National Board of Social Welfare, a governmental body who works a lot with indicators. We went to the universities and asked for help. And 137 distinct indicators from different levels, from indicators on an individual basis, so what would clients notice, how would staff notice, how would leaders notice, how would the society notice, what would be in place that wasn't in place today. We had a consensus conference where people worked with the Mentometer buttons, and they voted and they debated and then they voted. So we went down to 15 indicators, core indicators, what we saw. These were the most important indicators. And then we were finished with the first part of our project. And we thought, this is really interesting, and this was gathering interest from lots of other places in Sweden. So we thought, we've got to go to the government and ask for money so we could develop measures for these indicators. I'll show you the next picture just to show you. And this is an example of an indicator. Participants feel that activities that are offered are organised around their needs. In some way, they're person-centred. They would notice this. We needed measures. We need to find out, so which questions should we ask people to find out if this makes a difference? So we got money from the government, and we spent the rest of last year, the beginning of this year, to find measures for each of these 15 indicators. This is an example of one of the measures that we got. The question is posed to participants in a coordinated activity to ask the question, I get the support in a way that is useful for me, and a scale from 1 to 5, and ask the question several times during an activity or a project or a teamwork. We're now in the process of piloting this. The interest is gathering. We have now 12 pilots all around Sweden trying these measures, these indicators, and we also published a book on the subject. I've got a few copies with me here today, which documents the emergence of this project. I'd like to stress that this project is really interesting, because everywhere around Europe we talk about joining up services and building collaboration, but it's really difficult to evaluate, to know it makes a difference, because collaboration is fickle, changes every day, it's very local, every country has their own model, their own system, but I think the idea of coordination agencies has made it possible for us to have a better conversation and draw the resources locally and then to combine them nationally to find ways forward. And basically that's where I am in time. I don't know how far we're in time? Good? Because I kind of rushed through this, because this could be complicated and a bit abstract, but I hope you have some idea of what's been done. I'd like to say in this whole process, in this indicator project, we've had lots of workshops, seminars, big conferences, there's a lot of communication. And I think introducing solutions focus, both as a form and a content, has made a huge difference. So when we meet up at these workshops and these seminars, we ask best hopes, we talk about what's in the room, we ask their best ideas on how these indicators can be of help and use. We talk very much about a future perfect, and if we had these indicators, what difference would it make? And we take very, very small steps. I've also been very mindful to get as much help and support as possible, to be very inclusive and ask people to join in, and making it very easy for them to do that. And this explains one of the reasons why this project is very much a success.